Good evening. We are in a good place with this pandemic. A good place. We've done a good job. How's that sound to you? Does that sound like reality? That we're in a good place? Because those are the words the President of the United States today, even as the numbers and his own experts, scientists with decades of experience, say otherwise. The President says we are in a good place with the pandemic. Those are his actual words. I didn't actually believe it when I first heard it, but it's on tape. He was asked by Greta Van Susteren about Dr. Anthony Fauci's assessment that the country is still, quote, knee-deep in the first wave of coronavirus. Here's what he said.
Well, I think we are in a good place. I disagree with him. We've done a good job. I think we're actually, we are going to be in 2, 3, 4 weeks. By the time we next speak, I think we're going to be in very good shape.
So this is a good place to be in the pandemic, in case you're wondering. And soon we're going to be in a very, very good shape, he said. The president spoke of Florida and California, states that became, in his words, hot. But even there, he said, quote, we're going to be very, very good very soon. The same president who told Diamond and Silk that the virus would miraculously disappear by April, the one who keeps saying that we have the best testing, keeping him honest, it's remarkable how sunny things can look from inside a biological bunker at the White House, where everyone has to wear masks around you and get tested just to come in contact with you. It's a bunker so secure, apparently not even the sound of your own leading experts can penetrate it. The president says we're in a good place. Dr. Anthony Fauci said this just yesterday.
The current state is really not good in the sense that, as you know, we had been in a situation where we were averaging about 20,000 new cases a day. 2 days ago, it was at 57,500. So within a period of a week and a half, we've almost doubled the number of cases.
So, of course, the president doesn't have to take it from the nation's most trusted infectious disease expert. He could listen to other top members of his own virtually invisible coronavirus task force, who also acknowledged the situation today on a call with state governors. This is Vice President Mike Pence and Dr. Deborah Birx.
As you all know, many southern states have seen a rise in cases. As of this morning, I think, Dr. Birx, if you want to give a brief summary, we have 9 in the District of Columbia with rising cases combined with rising percent of positive.
Clearly, there is significant issues in California, Texas, Florida, and Arizona, growing issues in South Carolina and Georgia. And then just I want to really put the alert out there of both rising percent positive and rising cases in Oklahoma, Iowa, Washington State, D.C., and Montana, along with our concerns of increasing case numbers in Louisiana, Nevada, North Carolina, and Tennessee.
Yeah, that sounds good. I mean, that sounds like a good place to be, right? California, Texas, Florida, Arizona, South Carolina, Georgia, Oklahoma, Iowa, Washington State, Washington, D.C., Montana, Louisiana, Nevada, North Carolina, and Tennessee. That's 14 states in the District of Columbia. A good place. By the way, what you heard the vice president say on that call, acknowledging the rising cases and percentage of positives, he's also, without really actually saying it, acknowledging that when he said this just a couple weeks ago, he wasn't being honest about what was already happening in states the administration had pushed to reopen.
We slowed the spread. We flattened the curve. We saved lives.
We slowed the spread. We flattened the curve. We saved lives. That was from the last coronavirus briefing late last month. He was talking in the past tense, you might have noticed, but he wasn't then acknowledging the rise in cases that was already happening. Now he has no other choice, but the president wants you to believe everything is good. And today he talked about forcing schools to open and pretending that governors or school officials might be reticent to open because they think it helps them politically.
And we hope that most schools are going to be open. We don't want people to make political statements or do it for political reasons. They think it's going to be good for them politically, so they keep the schools closed. No way. So we're very much going to put pressure on governors and everybody else to open the schools, to get them open. And it's very important.
The man whose every decision is based on what will get him reelected, what will energize his base and appeal to people's most primal fears, is saying that governors and school officials don't want schools open because of politics, because it benefits them politically. We are so deep down into a well of lies, it is hard to even realize how dark this is. There's no political benefit in keeping schools closed, keeping kids upset and parents angry and parents unable to work because their kids are stuck at home. Oh yeah, politically, that's going to serve you really well by doing that. Right now, outside of a very few states, the entire country is dealing with the consequences of going too fast, too soon. And the president's urging, at the president's direction, as Vice President Pence always says, but without his leadership on how to do it safely, without his basic encouragement to wear masks and social distance while opening. As of tonight, infections are rising in 31 states, holding steady in 15 and dropping in just 4. And comparing states that rushed to reopen to those that didn't only underscores the point. Here's New York in green, Florida in pink. New York worked hard to get its cases down, has been cautious about reopening. Florida reopened quickly, and now new cases rising. The number of people being hospitalized growing, and in counties across the state, intensive care units operating at 100% capacity, no beds available. Yet against that grim backdrop, Florida's governor today ordered schools to reopen for in-person learning in the fall. And the president praised him for it, of course, even as he said that plans to hold the Republican National Convention in Jacksonville are now, quote, flexible. And even as new modeling from the University of Washington today forecasts more than 208,000 people in this country may be dead of COVID-19 by Election Day, which the president still does not seem to think is all that bad, because he is still repeating the same falsehoods as ever about testing and mortality, which fell for a while but is once again, sadly, sickeningly ticking up.
Therefore, we have more cases. Because we're doing more testing, we have more cases. If we did half the testing, we'd have far fewer cases. But people don't view it that way. What they have to view, though, is if you look at the chart, and maybe Mike has it, but we looked at it before. If you look at the chart of deaths, deaths are way down. So what we want to do is we want to get our schools open. We want to get them open quickly, beautifully in the fall.
Dr. Fauci calls the mortality claims, quote, a false narrative. And in any case, those numbers, they've begun rising again, more than 600 fatalities today compared to about 250 a day over the weekend. But the vice president, who briefly acknowledged reality today, then nodded, of course, and agreed and praised the president for his leadership, because that's what he does. And he tried to spin the president's lie about 99% of COVID cases being totally harmless. Here's how the vice president attempted to reinterpret that lie.
Well, look, the American people know President Trump is an optimist. He believes in this country, but he also believes the American people deserve to have the whole story.
What does that even mean? The president doesn't want you to know the whole story. If he wanted you to know the whole story, he wouldn't have stopped the virus task force daily briefings. He wouldn't have silenced Dr. Fauci and others from appearing on television like he used to. He wouldn't claim that we are in a good place. President Trump is not an optimist like the vice president is claiming, who just believes so gosh darn much in our country. He isn't an optimist at all. He's a fabulist. And the vice president can call a lie a hope, but it doesn't make it so. It's lipstick on a pig, Mr. Vice President. The American people, they do deserve the whole story, but they deserve the whole truth as well. In a moment, two public health experts in two hard-hit states, Texas and Florida. But first, more on the big picture from CNN's Nick Watt.
Big Tex taking a break for the first time since World War II. The Texas State Fair just cancelled as the military sends medical personnel to San Antonio to help.
The 4 days leading up to the 4th of July combined were the 4 deadliest days that we've had. My concern is that we may see greater fatalities going forward.
In Florida, ICUs in 43 hospitals are now full.
Especially we need to look at our younger population that we know had a tremendous spike in their positivity rate, which in turn has infected other people.
Florida still won't reveal how many COVID-19 patients they have in hospitals, despite the governor's claims today.
All the data that goes into this is all available.
Spreadsheet from that data, Governor, it is not available.
But Miami-Dade County does release COVID-19 hospital numbers, and they're up 90% in just 2 weeks. Still, the state just issued an order for schools to reopen next month. There's pushback.
We can't go on this path of putting our teachers in this petri dish of danger.
I will not reopen our school system August 24th if the conditions are what they are today.
In California, the state's capital now closed indefinitely after at least 5 lawmakers tested positive. Test lines are getting longer.
All of this just makes it so much harder to manage this disease.
Quest Diagnostics says last month results were taking 2 to 3 days. Now it's 4 to 6. Quick results are key in effectively isolating the infected.
The cases are rising so rapidly that we cannot even do contact tracing anymore.
Undiagnosed, silent spreaders might be responsible for around half of all cases, according to one new study. And as cases climb, nearly half of states now slowing or rolling back reopening.
If they keep moving up, we're going to dial back if we have to. And it's the last thing any of us wants.